This video is going to be about filling your dental appointment book. I'm Bruce Stevenson, the guy on the upper left. I've been a dentist for about 40 years. And on the upper right is Linda Piccinini, who's been my office manager for the last 30 years and is now my partner in Today's Dental Consulting. Today's Dental Consulting does seminars, webinars, individual consulting, office staff meetings, and fun little videos like this. We now even have a very exciting book called How to Run a Dental Practice, and you can find out more about that on our website at todaysdentalconsulting.com. So filling the appointment book can be a little bit stressful. And we're going to talk about some strategies to perhaps make it a little bit more efficient and a little bit easier for you. There are a couple videos you really should watch first, and it will help you to understand what I'm saying in this video. They're all free and they're all on our website. One of them is called Appointment Scheduling Systems and shows you the other strategies involved and the other factors involved in being able to schedule productively. And there's another video called Notes, Notes, Notes that shows you how to put proper notes in your computers, particularly as they relate to appointments. So watch those two videos before you look at this one, and then come back, and I think it'll make a little bit more sense. Before we get into filling the appointment book, let's talk about not creating an opening in the first place. Let's see what you can do to save the appointment when a patient calls up and says, I can't make my appointment this afternoon. So what do? Well, we have a little checklist. Two things. First of all, tell the patient, gee, we have a lot of patients waiting to see Jillian. She's our hygienist. It's going to be a while before I can get you back in. So set up the need for the patient to keep that appointment. And then you have to ask critical questions. Is there any possible way you can make this appointment? And then you shut up. Doesn't work very often, but sometimes it does work. And it's always worth doing. It's always worth saying these two things, because maybe the patient will say, oh, well, maybe I can get a different babysitter. Okay, I'll be there at 2 o'clock. You save the appointment. It's always worth a try. A couple more things you can do if you're gutsy. They really work, and they are good things to do, but a lot of people have difficulty with this. But two more steps. You have to say, okay, I need to call some of our other patients who are waiting for these appointments. Let me call you back in the next day or so to reschedule. And you don't reschedule that appointment. Now, the temptation is that you're to reschedule the appointment. You've got some time this afternoon, but you don't have to tell the patient that. But get them back in the book. That's a big temptation. I understand that. However, that's just what the patient expects. And the idea is to retrain your patients so they don't expect this. When they call at the last minute, make them wait a little bit, or at least make them think they may have to wait a little bit. So try that. You'll like it. It really does work. But it's difficult to do. I understand. All right, let's talk about the three most important jobs in the office. Scheduling, scheduling, and scheduling, of course. So here's our strategy for filling the appointment book. Don't panic, blow in the paper bag. Don't push the panic button there. So we're going to go through each one of these things in order, and hopefully they make a little bit of sense to you, and hopefully they'll be helpful. People often ask, why do I need a Facebook page? Nobody ever goes there. What good is it? And that's a really good question, because I don't see dentists getting a whole bunch of new patients as a result of Facebook. However, it is a useful way to keep in touch with patients. And if you set it up properly, people will want to go there, and it can help the office. So when you set up your Facebook page, you should put a place on there where you can post short notice appointments. And you should tell patients, If you take one of our short notice appointments when we post them on Facebook, you save 10% on that appointment. You get a 10% discount on that appointment. So give them a reason to follow you on Facebook. So you can see down there on the lower left on the Facebook page, we have 2 hygiene appointments for tomorrow. Now, the strategy here is that you post on there and then the patients call you for the openings in the appointment book instead of you frantically going through the book trying to find people to call. Now, this doesn't work 100% of the time, but it works some of the time. And it's a very easy, quick thing to do. But it's very important that you tell patients ahead of time that you have this discount available for them. So, why do people want to go to your Facebook page? Well, in addition to what we just talked about, you also should have drawings every time you meet one of your thresholds. So for instance, when you get 100 fans on Facebook, you have a drawing of all your Facebook fans and give away a gas card or whatever you want the prize to be. When you reach 200, you have another drawing of all the people who have liked you on Facebook, all your followers. So everybody that is liking you on Facebook, that is following you on Facebook, is in each one of your drawings, and you have a drawing every time you hit one of your thresholds. So again, you've got to tell people about this and maybe even have a little handout for them when they're in the office and say, here's a way you can save on dental fees and perhaps even win a prize. So emphasize it to the patients. Give them a reason to follow you on Facebook. Here's another example. You can see now this is actually on the website and it's simultaneously posted on Facebook. It goes both places automatically, and if you have a Twitter account, it can go there too. So don't forget to tell them they get a 10% discount if they fill one of your short notice appointments. So who's going to do the Facebook page for you? You know, dentist's not too interested in that, but I'll bet there's somebody on the staff who already loves Facebook. Put that person in charge of your Facebook page. What do you put on Facebook? Whatever you want. You know, patients love corny stuff like this. So put a wig on the dentist and take him to the ADA meeting, and then put the picture on Facebook. It doesn't matter. Patients like hokey things like this. We digressed here talking about Facebook because it's a good example of all the different pieces that have to come together in your office in order to effectively schedule. It's not one thing. I can't give you one magic bullet that's going to solve these problems. Too bad. You're going to have to do a whole bunch of things, but taken together, they work. How about, now we're looking for new patients here. We're looking for patients to fill our appointment book. We've got a hole in the schedule tomorrow that we want to fill. How about running a list of our new patients, quick list to run with most software, and looking for people who didn't really get their treatment done. Now, how can you tell? Well, you can tell if you look over here. You see that this is a 0, and you see a couple of these that are probably just had the exam. So those might be good people to call. Look in the chart, see if they had treatment that was proposed but not scheduled, and maybe do a little follow-up call. Now, the reason this is at the top of your strategies is because these are people that don't have appointments, and yet they need to come back for treatment, and you saw them fairly recently. If you were going to call somebody that was in a year ago, probably not going to be nearly as effective as calling somebody that was in the last couple weeks. So this is at the top of your list of things to do when you've got holes in the appointment book. Bring in those patients that don't have appointments. Follow-up phone calls. All right, let's look around in the office now. Is there anybody in the office that can help fill our schedule? For instance, is there anybody in the doctor's schedule right now that's due for recare? Or is there anybody in the hygienist schedule who needs to have treatment done? Can we do it today? That's a very effective way to increase your production, by the way, is to do it today. Now, it unfortunately takes a little bit of running around here at the last minute in order to move that patient over, but it's always worth looking. And it's a fairly easy thing to do. How about other family members for people that are in the office now? Now, she's here today, but I'll bet you he hasn't been in for a while. And maybe those two little rugrats are overdue for treatment too. So whoopee, look at your routing slip, and maybe, because routing slips typically have this information on them, maybe you can find another family member that doesn't have a recall appointment or has treatment pending, and talk to the wife, say, hey, can we get your husband in here to have that treatment or have his teeth cleaned or whatever it is that he may need. So look for family members using your routing slips. We talked about the importance of appointment notes when I said you needed to look at that video first, because these are just critically important when you start using these call lists. Now, the first call list here is your ASAP list. And we want to be able to look in there and see who else has called about these appointments. And we want to see the history of this appointment. Okay, so an ASAP list, what is that? That is a list of people who have appointments already. These are appointments that are scheduled in the book. But when you made the appointment, you asked them, if I have an opening, would you like to come in sooner? Now, don't say you had a cancellation. Say you had an opening. If you had an opening, would you like to come in sooner? And particularly if they want to come in on a Thursday afternoon or whatever. So you got to record there that they want to come in on Thursday afternoons, but you have your list generated because you've marked that appointment as going on your ASAP list when you created the appointment. All these things have to work together. So you created the appointment on the ASAP list, and now you can go through those patients, or through those appointments, and quickly call them. So I mentioned before, if I get a sooner appointment, can I call you? And then don't forget to ask, are there days of the week or times of the day that work best for you? And record that information in your appointment notes so it's available to whoever is going to make these calls. How about unscheduled treatment? Now, the unscheduled treatment list depends on your software exactly how this works. But what I'm thinking of with an unscheduled treatment list is an appointment that was made but then broken for some reason. Patient called at the last minute. Maybe they left a message and you didn't actually talk to them. Maybe they had an emergency. For whatever reason, they broke the appointment. So this was an appointment that was made and then broken, but was not remade. And we have a list of those. So when we want to read our notes in there to see why they canceled, and so has anybody called them since that time? You don't want to bug these patients to death, but you do want to be sure that you follow up and try and reschedule that appointment. So this is a good source of people to call, but again, you've got to have notes in there so you know what's going on. How about your insurance remaining treatment plans? Okay, most software has something like this. This happens to be Open Dental, but you can go in here and you can control things like how big a treatment plan you want to put in there. You can control the provider. You can search for, in this case, let's just search for the Crown treatment plans, or treatment plans that contain crowns. And you can search for this year, last year, whatever, and generate a list which will also show how much their insurance benefits is remaining. Gee, that's really pretty slick, huh? Now this is another Open Dental report. If you're not getting reports like this from your software, you really should think about switching to Open Dental. It's probably the best dental software out there, and it's free. Wow. Okay, and there's no catches to it. So who's the best person to call these patients, do you think? I think it's the person who helped make the financial arrangements, who was with the patient in the operatory at the time of the exam. It's probably the chair side. That's my personal opinion, but I think that person has the best rapport with the patients, if the initial exam sequence was followed properly. You do it however you want. All right, another list we can look at is your overdue recall list. A lot of people slip through the cracks, and I don't care how you do your recall system, whether you're doing it electronically with something like Demand Force, or whether you're sending out cards or whatever, but some people are going to fall through the cracks. And so you want to go back and look at your overdue recalls, and again, you want to look at your notes in there. So calling these people, this is obviously good for filling the hygiene schedule, but if these are way overdue appointments, you can also get them in for another appointment with the doctor for a re-exam. Say, well, it's been almost 2 years since we've seen you. Let me get you an appointment with the doctor just to do your checkup. And a mouth cancer exam too, of course. Might as well slip that in there. So in one study, this is kind of interesting, in one study of calling patients who had not been in the last 12 months, but had been in the previous 12 months. So these people are at least a year old, okay? Calling those patients, about 20% of them, actually it was more than 20%, rescheduled. So you brought those people back in to the practice by calling them from an overdue recall list. Okay, that's pretty interesting. That's a lot of people. Now, these are actual numbers in a real live practice. So when's the best time to call these people? Actually, the best time to get a hold of people to actually talk to them is between 5 and 7 p.m. So maybe somebody could do this from home. A staff person could do this from home if they had something like go to my PC so they could log into the office computers, or maybe somebody could actually stay in the office one evening a week to make these phone calls, because it's a very worthwhile thing to do. In this case, we got 28 patients back into the practice by making these phone calls. Now, you're obviously not 100% effective, and as a matter of fact, 80% of the people are not coming back to the practice for various reasons. But that's a lot of patients if you only get 20%. It's very hard to get new patients these days. Okay? Well, then we want to keep the ones that we got. And by doing things like this, we do. We not only fill the appointment book, but we keep the patients in the practice. So this pertains to recalls, and you can set the from date there, as you can see. So you can control who's on your list. Now, I don't advise that you actually make the calls just from this list. I advise that you use this list and then go into the patient's clinical chart, or if you're still using paper, you have to go into the patient's paper chart so that you understand what's going on with the patient. Speaking of calling patients, dialing for dollars here, I just mentioned you've got to look at the chart and understand what's going on with that patient and with that appointment. You've got to read any notes, and the notes should be in the computer. We talked about that in the notes video. The notes should be in the computer so you know if anybody made prior contact with the patient. When you call them, it's a good idea to invoke the doctor's authority. And so what you can say is that Dr. Stevenson remembered they hadn't seen you for quite a while and asked me to call you, and blah, blah, blah. So you still have treatment that you need to have done. I hope no teeth are bothering you. And then you always want to finish with, are there days of the week or times of the day that work best for you? So you're going right into what salespeople call the close. And don't ask, would you like to schedule an appointment? Because then they just say no. Just assume that they're going to schedule an appointment. So it's not that hard. These are just samples of little verbal skills that you can use, and they work. Not 100% though, unfortunately. So here's what we talked about. Posting on Facebook, okay, good idea, free, quick, and somewhat effective. Calling patients who had a recent new patient exam. Looking around in the office, see who's there or what relatives perhaps that you could work on. Looking at your ASAP list, your unscheduled treatment list, your treatment remaining list, which had the insurance, your overdue recall list. So we got lots of different lists that we can look at. And maybe different people should even be working on different lists. Now, a lot of the same people, patients, may end up on these different lists. So patients may be duplicated on different lists. But if you've got your notes properly entered in the computer, not in the paper chart, notes go in the computer where everybody can see them simultaneously. So you put your notes in the computer, and then one person's not going to call the patient and turn around and have another person call them 10 minutes later because they're on another list. Okay, the notes are in the computer. Your last resort. You've done all these things. You're blown in the paper bag because you're hyperventilating. What else can you do? You can look a week out in your appointment book and see if there's somebody who's coming in next Thursday, if this is Thursday, somebody coming in next Thursday afternoon who might want to come in this Thursday afternoon instead. So you pull from a week out. There's probably a reason why that person was scheduled on a Thursday afternoon. There may be a reason why they were scheduled on that specific Thursday afternoon, in which case they won't want to come in earlier. But perhaps they just like Thursday afternoons and they could come in today. So at your last resort, however, you want to do all those other things first, because most of those other things involve bringing people in who do not already have an appointment. So they increase patient retention as well as fill the appointment book. Filling the appointment book, as I mentioned before, involves lots of little pieces of the puzzle. They all have to fit together. All your office systems really come together when you talk about scheduling an appointment. So hopefully some of these suggestions have been valuable. Don't forget to look at the other two video notes, and appointment scheduling systems so that this whole thing works together. So again, we're today's Dental Consulting. If we can help you in any way, please feel free to give Linda a call or send us an email or look around on our website. We hope this and our other little videos are helpful for you.